Have you ever wondered, why does it work that way? Or thought, how can we thrive with Medicare Advantage under these conditions? You're not alone. Jenn has wondered all those things and more. Every month, join Jenn Kerfoot and a motley crew of friends as they bring you candid conversations with industry pros, break down important updates, and share insider tips to boost star ratings. Whether you've been around since before Medicare had the advantage or are just starting out, there's always something new to learn. Welcome to Stars Unscripted.
All right. Well, hello, everyone, and thank you for joining us for another episode of Stars Unscripted. I'm your host, Jenn Kerfoot. I'm really excited today. One of my favorite people in Medicare Advantage is joining me, Archie Dey. He's the VP of Consumer Experience and Insights at SCAN. We're going to dig into what that title means, Archie, because I was like looking at a bunch of titles the other day, and I was like, I wonder what Archie's title converts to the work he does. So I'm super excited, to talk to you today. Do you want to introduce yourselves a little bit to the folks, and then we can get started?
Sounds good. Well, super excited to see you, Jen. I feel like a lot of the discussions we have are always in the what's next in healthcare
Yeah.
and in Medicare. So excited to be here. I'm Archie Dey. I lead the consumer experience and insights function at SCAN, and what it really means is really helping SCAN deliver its mission of keeping seniors healthy and independent through data, through research, through experience design to kind of really figure out what are the meaningful experiences we can deliver to our older adults.
I love that. You're working in the future. I just came back from the Risk Adjustment Conference in California, and it sounds like a lot of people are just still working on analog, and you're in the future talking about AI. And, I have to admit, every time I think about SCAN, fun fact, I started my career in California, so I know a lot about your market. But anytime I heard about SCAN, I get a little happy because, not a lot of people know, SCAN, it stands for Senior Action Care Network, or Senior Care Action Network. And it wasn't founded by a big insurer or venture-backed startup. It was created by seniors in their community and people in the Long Beach area who saw gaps in the care that they were getting and that their neighbors were receiving. And they're like, let's do something about it, which I think is pretty badass. And I think it's more than just an inspirational story. It's foundational. And it reminds us that, that healthcare, it should be shaped around, the people that it serves. So I think it's fitting today that you're coming off of, opening up, the new community center in Nevada. You just saw members in real life in the wild, and really excited, to dive into that. So would love to know what did you take back from being in Nevada, and why did SCAN choose specifically that state for its latest expansion and adding that community center?
Mm-hmm. No, thank you, Jen, for kind of mentioning the SCAN story, and I feel like the Nevada story is very related to the SCAN story. So as you say, SCAN was founded by 12 angry seniors who were not happy with the healthcare system, and so they built a plan around it. And the initial version of SCAN was really all around social HMO. And then SCAN was founded 1977. So think about it, 48 years pretty much in existence. So all the things we talk about today, like social determinants of health and equitable access, all those things, SCAN was the pioneer in defining those back in 1977. Yes, the wordings might have changed,
Wow.
how people
Yeah.
think it have changed, but that was exactly the founding principles of SCAN. Which
Love
was
that.
really all around social HMO. So why Nevada? So I think for SCAN as a non-profit company,
Mm.
we are kind of what we kind of think about ourselves is we are rebels with a cause, and
Yeah.
the cause is keeping seniors healthy and independent. And so we believe that the healthcare system is fragmented. We believe that there are a lot of issues and challenges in how healthcare delivery is, and we believe that with all the areas of innovation, whether it's digital, whether it's non-digital, we believe that still the healthcare system is fragmented, and we're not solving the real problems around access to care.
Mm.
Um, Jokes aside, it takes roughly 3 to 6 months to even get an appointment with a specialist, and
Wow.
and that is a real problem in our space. And so why Nevada, right? And so scan is growing nationally. So right now we are
Hmm.
in 5 states, with California, Arizona, Nevada, Texas, New Mexico,
Oh, wow.
and we are growing. We are growing as a national footprint because we believe the simple thing that what we do for our older adults, we should give access to other older adults across the nation to get the same scan service and the same scan brand promise. And so Nevada market is very unique in its own way. Like as you may already know, like the penetration of like Nevada Medicare
Hmm.
eligibles is roughly around like 53%, which
Oh,
is
wow.
a little bit higher than the typical national average of 51%.
Yeah.
And so Nevada is definitely an area where a lot of older adults are retiring and going back to Nevada, and they're moving away from their homes in California or
Hmm.
in
Yeah.
Arizona or in other states. Like we have found very interesting insight that a lot of the Nevada retirees kind of live on their own while their kids are in other states.
Oh, wow.
Uh, and the Nevada community, the older adult community, is so catered to like being in the community. Like they
Hmm.
have a huge group of like older adults who hang out together, and there are a lot of activities. And so
I love that.
it's actually a pretty cool piece of like insight as well as findings we saw in the Nevada market, which makes it kind of very unique.
No, I really love that. I think that a lot of times when I'm talking to different product leaders or plan leaders about like, why did you choose to go into a new service area? I hear answers like, there's a double bonus county, or we had a strategic, partnership with an IPA, but really taking kind of that, macro look at a population and the concentration. And like you said, delivering that brand promise that your members in California are getting to an area
Mhm.
where it sounds like a lot of folks are moving to as they retire. It is a one of the states that does not have an income tax, so very similar to Florida, but maybe
Mhm.
because it's landlocked, it's isolated from things like hurricanes and maybe wildfires. I don't know a whole lot about that with regards to Nevada, but the way you describe it, it's a very similar approach to companies that I see that take a direct to consumer strategy. How can
Mhm.
we create products that the consumer wants, and by delivering a promise, you increase and maximize that LTV, that lifetime value, to that cost of acquisition. And I know I've heard you speak a lot, and I've seen your awesome LinkedIn posts. And if you don't follow Archie on LinkedIn, you should, because he's posting some real smart stuff. Why do you think this direct to consumer approach is really critical for Medicare Advantage plans today?
Mhm. Yeah, so that's a great question. And so, in order to answer that question, we have to kind of think through like the distribution channels
Mm,
of like how Medicare is sold. And
yeah.
typically, the main sources, the distribution channel is the broker channel, and then the
Mm,
telesales channel,
hmm.
and then the employed sales are what we call the field sales, and then there is
Hmm.
online, right? Now, the broker channel is obviously the most expensive channel. So when you kind
By
of
far.
mentioned about by far, right?
Hmm.
And so when you kind of mention the long-term value of a
Hmm.
member, the broker channel long-term value is going to be shorter because smaller, just because of like the cost of acquisition through a broker channel.
Hmm.
But what we are seeing in the market is that brokers are driving a huge, like huge part of like sales, right?
Hmm.
And you typically run across like around 70% to
Yeah.
75, sometimes 80% of your distribution is coming through the broker channel.
Mm.
But here is the interesting trend which we are seeing. Here's the baby boomers, or kind of the younger older adults who are kind of in the range of 65 to 75 ish, more like 65 to 70, 70 per se. Their kind of behavior is changing, and what I mean by
Mm.
that is the previous behavior was, well, yes, Medicare is complex, I cannot find information,
Hmm.
so let me talk to somebody to make sure
Yeah.
I make a choice around which plan to go with. Now, the trend which has happened, which is not so much of a healthcare trend, I think is more like the analogous industry trend, which is
Hmm.
people like Amazons of the world and some of like the
Hmm.
other consumer facing of the world. What they have done is they have simplified the process of
Mm,
like research and making decisions,
mm,
and what it has activated, what I call the identity and agency of an older adult, which is,
mm.
hey, look, I'm 65 years old. I have lived 65 years of my prime life.
Yeah.
I'm really good at what I do, and I'm a lot more wiser right now.
Yeah.
And the part of the identity comes in, which is, hey, maybe I should be making my own decisions by looking at it. And
Mm.
so the previous kind of trend of health plans was like send them a lot of direct mail, which is still a prevalent, right?
Yeah.
But what they
Expensive too.
did, and expensive too, right?
Expensive.
So as the older adults have a lot more become digitally savvy, and they have figured out like how to search things online and compare, what has happened is that the health plans have started promoting content on their
Mm.
websites and other places to help them make good decisions.
Yeah.
And as a result, all the older adults are kind of moving to the online channels where they
Oh
want to
wow.
kind of research on their own. So, for example, I went to one of the older adults' house, and what they do is they basically look at different plans and they create an Excel spreadsheet,
No,
right?
that's so awesome.
That is so freaking awesome.
Yeah.
And it's not a 5 line Excel spreadsheet, Jen. It's like 25, 30 lines of Excel spreadsheet, which
What?
literally lays down all the key benefits and basically has columns for scan and the other competitors
Wow.
and compares it. Now, that's the beauty. That's the beauty of like
That's
consumerism.
incredible.
That's the beauty of like consumer research. That's the beauty of the identity. And so what we're seeing is that through Medicare.gov, as well as the online channels, whether it's like the health plans enrollment tool or
Mm.
not, people are getting more familiar with how to look for products and how to compare products, how to think about
Wow.
the products in their own kind of life segment and be able to
Mm.
make choices. And so the trend which we're seeing is that there is a higher increase in online enrollment through Medicare.gov or through online tool. And right now, roughly it's at national average around 7%. And
Wow.
SCAN strongly believes in it that hey, we need to provide all the tools to our consumers and our Medicare shoppers in the channel they prefer, in the way they prefer. If they don't want to talk to a broker, more power to them. We will
Yeah.
provide them enough information so that they can make the choice easier. And what we are seeing at Scan side is we are roughly arounding like 10% to 11% of our enrollment mix coming through the online channel,
Oh wow.
which is huge,
That
right?
is.
and
It's
and and that
incredible.
and that is kind of one of our focus to kind of like really keep moving on it, but the real goal is like giving consumers the choice of their preference.
Oh no, absolutely. I think of like last time I bought a vehicle, everyone knows who knows me well. I love Costco because I can quickly see vehicles, I can compare them, and then I can make an informed decision based on cost, based on what my preferences are. And I think that's becoming something that is table stakes. And this idea that, older adults, it's kind of that you see silver sneakers, like that silver era where you just want to sit kind of in a corner and be left alone. No, these individuals want to have a vibrant, exciting life and they want to pick a plan that's reflective of that. And, being able to personalize channels where members can quickly make informed decisions based on where they are in their life cycle. I tell folks, the reason why we have AEP, and I know recently I think RFK floated that maybe we have 2-year enrollment periods, but the reason why
Hmm.
we have AEP every year and members can change their plan is because they're changing in how we design, plan benefits is for a certain kind of profile or phase of life. And so as a licensed broker myself, I still do it. I still enroll the same 15 members I did at the very first health plan I was at. And I say, okay, where are we at in our planning? Like what has changed as you get older and making sure you're in a PBP that's in alignment with where you are in life right now. And think that, like, I love that you said this member's making this 30 row spreadsheet because they want to be able to look at where they are in their life and make that informed decision. And this is not to say that the broker role, I know there's been a lot of lawsuits, a lot of consternation about brokers.
Hmm.
It doesn't mean that they still don't have a role. I believe that, while there are and always, I think, will be in any industry bad actors, for a lot, especially looking at, California, Southern California, a broker might be that first touch point for that member, especially for individuals within different minority communities that might not have English as their first language. That broker might be reflective of their cultural and linguistic preferences and somebody in their community that they trust. And so there still is a role for that. But I think what I'm hearing you say is it's important to, as a plan, offer options that meet those different segments, those different identity profiles of those members. And so, I mean, I'm super excited hearing this. I know that Medicare.gov had a lot of money poured into it to really make it a better, more user-friendly system. I know CMS has an RFI out right now around digital access that if folks listening haven't responded to, I always love to respond to CMS anytime they ask me for my opinion. I don't know if they read it, but I think when you're thinking about kind of this direct to consumer model, I know that I've heard you speak and talk about this idea of design thinking and design focused innovation. How do you think healthcare has historically lacked that focus? But also, like, how are you integrating that into your consumer experience strategy and kind of these member identity profiles?
Mm-hmm. Yeah, definitely. So as we kind of you kind of hit upon a very good point around the brokers, and I'm going to connect it to like the question which you asked. Like our CEO, like Dr. Sachin Jain, he has this wonderful idea around like brokers as like community social workers, community health
Absolutely.
workers, right? And to your point, like we do know like a lot of our ethnic population, like especially the Asian American ethnic
Hmm.
population, they do have a great connection with the brokers, where the brokers are in the community kind of helping
Hmm.
them kind of like make good decisions, right? And they are with them throughout their time with the health plan, helping them resolve some of the issues, working along with the health plan. So again, like they have a huge part, and
Hmm.
I believe that their role is evolving to really that
Mm.
community health worker, and as a plan who can really embrace the role of a broker as a community health worker is really where the value and everything kind of comes together,
I'm here for that.
right?
I'd
so
love to see
so
that.
connecting back to your question, like why I believe like healthcare traditionally has been like lacking in the design thinking. um like like McKinsey had a whole article around like how design thinking kind of improves a lot of different things, and what we have seen is the design led companies have a lot more higher like outputs in terms of business outcomes and
Mm.
profitable outcomes versus non-design led companies. And
Hmm.
interestingly or not a lot of healthcare companies are in that top
Mm.
50 list, right?
Wow.
And so why, right? Because I kind of struggle with the similar question, why? And I think there's few things I can think of. Like one is a lot of healthcare is very like clinician centric model
Mm.
versus a patient centric model. And
Mm.
so a lot of the decisions in healthcare are more around like how do we deliver the clinical outcomes
Mm.
without the patient in the center, like what it means really for the member. Perfect example, in one of our research studies, we talked with a member, and I'll call him Ben. And Ben had like recently had a fall,
Oh, wow.
and he went to the doctor, and he was telling us the story, and like it was the intervention was all around fall, which is like, oh, you need to do this physical therapy, and you need to
Mm.
do this, you need to take this medication for the pain. And what Ben really wanted was he just wants to go back to line dancing, which is what he enjoyed, right?
Ah.
And so his treatment was, how does Ben go from where he is to line dancing? And if the treatment was in that context, then it would be a lot more effective in helping
Mm.
Ben move to line dancing. And that's kind of where the I feel like the design led thinking is like the biggest area, is like so much clinician focused, and obviously it should be for the
Yeah.
right reasons. But the key is, how do you get the patient's goals and what the patient is trying to do or the member is trying to do? They are people. So help the people achieve their goals. And their goals are typically not healthcare goals. Their goals are life goals, whether it's spending
Absolutely.
time with their family, doing their hobby, hanging out in the community. And the goal of a clinician or of our health plan as a health system is to help the member achieve their goals. So that's I think one of the main reasons. And then some of like the healthcare challenges, right? Like the fragmented systems, the data
Mm,
silos. As a result, like the design thinking is just hard to deliver because
mm,
you have to kind of make sure all the parties are involved, and the data and the design flows seamlessly across the different systems so that we can deliver a seamless experience. So I feel like those are some of the fundamental
yeah.
challenges. And I believe that, like health plans and health organizations are shifting. Like if you
Mm,
think about like Oak Street, or if you
mm,
think about like some of like the other companies, like maybe like even Devoted Health, like
mm,
they are leading with the design led thinking, just like Scan. We are placing a huge importance in how we use experience design and human centered thinking, and how we think about experiences and deliver experiences. And so the tide is changing. um,
mm.
so it's in the step in the right direction, but I believe that more health plans and more health organizations, if they focus on it, I think it will lead to better health outcomes as well as business outcomes.
No, I really love that story of Ben and how, he went in because he had a fall, but what he wanted to get to was, getting back to line dancing. And I think about kind of our own origin story at Duos, where we started as a one-to-one telephonic model. And there's a great story of in the early days, a member, he had, unmanaged chronic conditions, but he didn't want to talk about his chronic conditions. He wanted to talk about the fact that he couldn't keep his power on, that he was food insecure. And our agents, and we still have this call, and I've listened to it several times. She really worked with him because she's a former social worker, actually,
Hmm.
to identify what resources did he have, and what that led to was in that about 2 hour phone call, she taught him how to use Facebook Marketplace because he had chickens. And he had a
Uh-huh.
lot of eggs and a lot of chickens where he could sell his chickens and sell his eggs so he could keep his power on. But when we shifted to be able to scale at large, how do you take that unique interaction and segment across multiple different types of members, personas, and profiles to deliver that at scale? And what we came to the conclusion of, it's identifying the intent. A lot of times when
Hmm.
I would used to talk to members at the health plan, the question they're asking isn't, necessarily going to be the answer that a typical agent will be able to give them in a way that addresses what they really want. And so at Duos,
Hmm.
our technology and what we do is really to identify the intent. What is it that in destination? And for a lot of folks, I'm really passionate about talking to folks where I say, when you retire, you've saved up, you've not gone on vacation, you haven't gone fishing because you had to take care of people or you had to go to work. And when you retire, you hit 65. Now is the time you get to do all those things that you didn't get the opportunity to do, like line dancing. But how sad is it when, their health conditions or just basic lack of not being able to understand how to navigate this complex system prevents
Hmm.
them from doing that. And by delivering kind of what you're talking about, that really design led forward plan design and just any type of intervention design, we're able to give that dream that is deferred to those members, which gets me really really excited. I think a lot of what's going on in the industry is focused around AI. While we've been talking, there's a new AI company that's been created and funded. But, where the rubber meets the road, URAC and NCQA are talking about accreditation standards for ethical use of AI. We have the new bill that's, being talked about with bipartisan support about creating funding mechanisms and rails to reimburse on these AI and FDA approved technologies. When you at Scan are thinking about all the things you want to do and your expansion to be having that national footprint to bring that promise from California to the rest of the country, how are you looking at utilizing AI to really help, take that one experience that Ben had and being able to scale that for a lot of members? I know you guys just hit your 300,000 member mark. Congratulations, but that's a lot of members to segment.
Hmm. Hmm. No, that's a great point. So the way we kind of think about AI is, we have very dedicated focus on AI as an organization, and there's several use cases of where we have already deployed AI. And so one of the unique things which we have done is obviously we have kind of rolled out Copilot, but Scan, we have kind of built our own GPTX where we actually use that to mine all the data, all the unstructured data across our actual call notes, our actual call recording, and as well as all the grievances notes.
Oh,
So to
wow.
your question, how do we manage all the 300,000? Well, we don't QA one by one. We do definitely use AI
Wow.
and the GPTX power to really like mine all of that data and identify the opportunities, which are then kind of prioritized based on impact and severity,
Mm,
which is like how painful it is, right? Like for example, every denial is super painful
yeah.
versus like a similar inquiry, right? And
Hmm.
so we use AI to kind of really mine all of that data and really take out the insights and then feed it into the design or the intervention kind of funnel. And so we use a lot of that to kind of as part of our voice of the customer strategy,
Mm,
able to like get all those information. The other great uses are like Scan is I believe like Scan is really in the forefront of leading AI revolution. And so for example, a lot of the business teams have kind of built their like AI like builder like an agent AI where
yeah.
they build their own apps to solve some of like
Wow.
the value-based customer issues. And so
Absolutely.
the power is when everybody at Scan starts using it, and that's like the beauty of it,
Mm,
right? Because if one person uses it or one vendor uses it, we never get the power and the economies of scale. And so that's like the beauty of Scan, where like the CXI that our team uses
yeah.
like NLP and AI to kind of do that. We use AI to figure out first look insights, like when the
Mm,
competitor kind of publishes like the first looks, we use that to kind of
wow.
inform our AEP strategy. We, like as I mentioned, business teams have started using like building their own apps to kind of extract insights from that, and that's where I see the real power of AI, where everybody kind of starts
Wow.
using it for different reasons. Our lawyers use an app for helping with their contracting language.
Yeah.
Our marketing and communications teams uses AI to help them kind of think about like how we communicate better to members. So I believe AI is like fundamental of how we make decisions. And with the advent of AI, like the way we used to do things is
Mm,
completely changed. Like even
no.
marketing, like
So
you
true.
kind of talked about direct to consumer sales
Hmm.
marketing, right?
Yeah.
The way we did direct to consumer sales marketing, like say 5 years back, is completely different right now
Oh,
because
completely different.
it's all managed by like the optimizations, which is basically an AI engine is running in the back, which kind of works on the back of like a consumer data platform and a
Wow.
DMP platform to really identify that Jen is the right person who
Yeah.
we want to bring it on. And so
Yeah.
target Jen and don't target Archie.
Yeah.
That's the
It's
beauty. I
incredible.
couldn't do that 5 years back, but I
Yeah.
now I can do that. And that's what I see is like is the same things we're doing, but we're doing it in a much more efficient and a smarter way.
Wow, that gets me really excited. I think, one thing, you know, the title of the podcast is Stars Unscripted, and bringing it back to a star ratings focus is, thinking about, I hear like a lot of times talking to quality teams, they're like, yeah, when we call our members, they're like, stop calling me, or I already did that. So thinking about how you could leverage technology like this to say, okay, well, Archie always gets his annual wellness visit at this time every year. We're not going to call Archie. But Jen probably hasn't been to the doctor in 7 years. So maybe we should proactively look into what is the reason why, Jen's not going to the doctor, or is there a transportation barrier? Is it a service area barrier? Is it a provider network issue where it's not, we don't have a network to support the cultural and linguistic preferences of a certain member? And that gets me really, really excited because, you know, CAPS is, access to care is a perception. Access to care isn't network adequacy. It's how does the individual member feel about being able to get the right care at the right time when they need it. And I think what gets me most excited about this type of technology, and also not just using the technology in a silo, but also overlaying that with the direct to consumer approach that we talked about, and also that design thinking, what you get is this really nice sweet spot where you can really understand and personalize these kind of interactions with members. We talked about brokers. One of the reasons I historically have really struggled with the broker and the FMO relationship because it's driven transactionally. And a lot of times, even when our teams they are well intended around that outcome, we're calling members saying, hey, I know I haven't talked to you for a really long time, but you mind getting a colonoscopy for a $25 gift card? That in and of itself is transactional as well. And so even if the member does get the service, after they get that gift card, they have no reason to communicate with the health plan to let them know, maybe they don't understand their benefits. And I think that, as the advent of AI has really opened up a whole new level of what we can understand about our members. I also am really excited of what it can do for our internal teams. I was at a smaller health plan in California, and the woman running our appeal, she's like, I hate my job and I quit. And I'm like, does anybody know how to do that? No? Okay. I guess I'm going to do that now. But I think as we start thinking about the democratization of knowledge, like risk adjustment teams that don't understand how star ratings work, star rating that doesn't know how risk adjustment works, no one talks to the case managers. We're not collecting those insights in a way that's understandable for those individual business unit owners. I'm really excited of where you say those individual departments are creating their own apps, how that will accelerate, the collaboration cross-functionally, because Stars is a team sport. And the bid team that is really how we design products is the input to what the star ratings team inherits. And if, we're configuring products that don't align to the population, no matter how many gift cards I give out, no matter how many colonoscopies we get, we're not going to get that in terms of the results we want for CAPS. And Haas is kind of freaking a lot of people out with that increase in maintaining, improving mental and physical health. Understanding, what is it that, is detracting people from focusing on their mental and physical health is exactly what you're getting at, which makes me really excited as a whole. In terms of where you think that, you said,
So
where
Jen,
you're,
on that, like on
yeah.
because you mentioned something like super near and dear to my heart,
Sweet.
like caps and 5 stars
Yeah.
and like the AI. So one of my fundamental belief, and this is a trend which we're seeing from research, one of my fundamental belief is that healthcare is very paternalistic. And
Very.
what I mean by that is we believe that we need to send X number of things like flu shots,
Yeah.
mammograms, colonoscopy, like reminders and all
Yeah.
that. Now, when you kind of think that kind of paternalistic kind of concept, even like thinking about like a parent-child relationship or even like a friend-to-friend relationship, because I like to think of everything as a relationship, and that's kind of my basic mental model. The fundamental challenge of a paternalistic model is that one person is keep pushing the other person to say you should do this. Now, from a foundational how human behavior works, that model doesn't work because the other person doesn't have the right motivations and the behaviors to accept or adopt what somebody is saying. And so the way you kind of change that model, I believe, is what we are seeing from the research, that identity and agency is a huge, huge unmet latent need of an older adult,
Oh, wow.
which is not met by a health system. And so to kind of
Interesting.
build on that, if imagine a world where we as a health system, we don't have to actually tell our patients like do this, do this, do this, like constantly reminding them,
Yes.
especially when they move from commercial where nobody talks to you and then
Yeah.
everybody's like talking to you. What if the situation changes that where we provide data and motivations for them so that they realize that they have to make healthy choices?
Yes.
That's where I feel like AI and context and
Love that.
personalization comes together. think of like stock market, like a very different
Yes.
example, right? In stock market, you get predictions, right?
Mm-hmm.
Like based upon like the stock market, this is our future predictions. You can buy,
Mm-hmm.
sell, think.
Yep.
A consumer can make a choice, right? Based
Mm.
upon different things. That is where I believe a healthcare should be, which is, hey, based
Wow.
upon this data, this is your risk score for a heart attack. This
Yeah.
is your risk score for a fall. Now you make a choice
Yeah.
what you want to do. And now, if you want to make a choice, well, these are the options. And so, what it does is it shifts the paradigm from a health system like a paternalistic to like a parent child relation. Like, hey, what do you want to do? What is more important to you?
Wow.
If you want to do line dancing, hey, Ben, you need to do these things.
Yeah.
That's where I believe that there's a fundamental difference or a fundamental change needs to happen on how we communicate to our members. And that's where AI is going to be super helpful because it's going to connect all that data and bring things in context. And once things are in context in the life of a member, the paradigm shifts.
Yes. I
I
love that.
believe I believe that is where the future should be. That is where we should be going as a health system because the constant reminders, as you say, the gift cards, everything is
Yeah.
transactional. It's not in the context.
Yeah, I love
Doesn't
that
work.
so much. I think that, when I think about, end-to-end healthcare, and just the linguistics of it, we say gaps in care, they're non-adherent, they're non-compliant. They're not, seniors have made it this far, they walk among us, they're not petulant little children that's like, they wake up, they're like, you know what sounds good, getting cancer. There's a reason either in how we are communicating that doesn't drive urgency and
Mhm.
understanding, or there's a barrier preventing them from taking action, and we can use AI and data to inform what is the barrier so we can start working to solve those barriers for members, like the work we do at Duos, but also in terms of fine tuning that communication in a way that's also, compliant, because none of us look good in orange, but making sure that we are articulating to the member in a way that resonates with them to take action. I really hope y'all expand wherever I'm living when I retire, because that's the kind of plan that I definitely want to be living in.
Awesome,
Um,
Jen. I'll
yeah.
be the person. We will sign up together. Let's
Deal.
put it that let's put it
Deal.
that way.
I'm here for that. But, to close us out today, Archie, like, I really appreciate you coming on and sharing these great insights. A lot of times I talk to different plan leaders from various different departments that are like, the only thing we can do is the book that we have. Every year we're going to do the same thing. We're going to pay the brokers. We're going to do this. We're going to send cold calls. We're going to send, gift cards. And it sounds like there is an alternative solution, and it comes down to intentionally, leveraging technology, thinking a little bit differently and taking some, insights from other industries, like, direct to consumer. I get marketed, my Instagram algorithm knows me very well. They serve me ads exactly when I want to buy,
Exactly.
like tying that into what we're doing. Any last thoughts that you want the listeners to hear in terms of like how they can really take kind of this seed of knowledge that you've planted back to their own internal organizations?
Mhm. Um, I think Scan is really doing a lot of interesting stuff. And as the listeners of this podcast, what I really want the listeners and their leadership, because I strongly believe that the buy-in comes from the leadership and our CEO, Dr. Sachin Jain, like some of the leaders we have brought in, like Trish Cox, our Chief Experience
Mm-hmm.
Officer, like Senthu, our Chief Commercial Officer, like Karen, who
Mm-hmm.
are president, they're all like we have this thing called ways of working called member obsession. And
Mm.
what it basically means is that even one member like issue is a big issue.
Mm.
And that's the thinking. So I
I
feel
love
like
that.
the what I want these listeners to kind of really take back few things. One is like really be member obsessed and mean it. So
Mm.
every bad issue of a member is an area of opportunity and that needs to come from our
Mm.
leadership and Scan leadership like walks the talk. The
Mm.
second thing is in order to really be that member obsessed, like make sure that we invest in like design and experience
Mm-hmm.
design as a function, as a core capability,
Mm.
as a quarterback working within the organization who basically defines the play and then gives the ball to the different teams in a coordinated fashion so that they can win the play. I think
Mm.
those two things, like as we think about culture, as we think about like skills, like people who we need to kind of deliver it, because somebody has to think through the whole thing and connect the dots. And last but not the least is the technology piece, which we talked about, is like, don't underestimate the power of AI. You have to be on that bandwagon. AI can help you enable that contextual, that next best experiences, making transactional relationships a relation, like actually like relationship metric. That's what the key is. And so if we do those three things, which is culture, the people with the right skill sets, and the use of AI to like guide your decision making, those are like three-pronged framework for any listener kind of taking back to the organization.
I love that so much. I can't follow that because you said it so well. But Archie, thank you so much for joining me on this episode of Stars Unscripted. And if people want to follow you on LinkedIn, we'll put your LinkedIn URL somewhere down below here. And check out Scan and see what they're doing. But thanks, Archie.
Thank you so much. I had a great time, Jen. See you later.
Bye.
Bye.
As a Medicare Stars professional, you're on a mission to boost your plan's ratings. But complex data and endless metrics make it more than challenging. Enter Stars Monitor by Hyperlift, your guide to improved performance. Our dashboards pinpoint your most impactful opportunities. By focusing on what truly matters, you'll avoid the pitfall of missed targets and achieve the goal of steady improvement. Take the first step towards your Stars success story. Email results@hyperlift.com for a free demo. Stars Monitor by Hyperlift, providing speed to clarity.